Coming up next, we're going to talk about a condition that's easy to diagnose because it has blisters that are very painful, usually worse at night. But if it's not treated appropriately, it can last for the rest of your life.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.
I'm Dr. Carrasco.
I'm Dr. Alex DeJesus.
You know, Alex, we talked about a lot of painful conditions, but this is one of the most painful conditions there is. It causes severe pain in these patients. Sometimes suicide is one of their only options.
Well, we're talking about postherpetic neuralgia, and what is that exactly? How do you get that?
Well, when you're young, you end up getting chickenpox. And that varicella virus stays dormant or asleep in the dorsal root ganglion, big word, but near the spine. So what happens, Alex, is that right in here, we have what we call the dorsal root ganglion of the spine. So right in here, the nerves kind of stay asleep right there. And during a time of physical or emotional stress, they're released down that area.
So this virus you never cure. It's yours. You got it. It has a little house that it lives in. It's there.
It's going to be
Your
there.
immune system keeps the door locked.
Exactly. That's a good way to say it. But if you're under physical stress, if you had a surgery, you had some kind of ailment or something like that, maybe such a bad cold, or if you're under a lot of emotional stress where the immune system is diminished, you can have this condition. It's released.
Don't we
unlock the doors,
we also tend to see this more during October, November, the cool months for some reason?
Well, you know, I tend to see it all the time, and I see it in all different parts of the body. Let me tell you about the anatomy a little bit. All right, so here's what's happening now. We talked on the model, but let's talk about here. This is the actual spine, and the nerves come out of both sides and go all the way down the body. They come around to both sides. But what happens is it's released here, for example. It travels right around these nerves, right around the ribs, all the way around here, and it travels around to the center. So one thing about this is when you have blisters, generally most people have blisters, and then this pain will go right along the same to follow those blisters. It can be sharp, shooting, electrical, burning pain, real severe, and especially worse at night.
It's going to be on both sides or only on the side of the blisters?
It's only going to be on the side of the blisters, and it doesn't cross the midline. Okay, it's kind of some fluid-filled, kind of grayish-brown blisters is what we see. Whenever those blisters are still there, the person is considered to be contagious. So if you have this problem with shingles and those blisters are not dried up yet, then you can give chickenpox to someone who's had
So
that
the
before.
patient comes to the clinic and they have the blisters. Do I have to do a bunch of lab x-rays, MRIs to know what else they have?
No, I mean, you can draw an assay, you can draw some blood on it, but quite frankly, looking at it, knowing where it is and where it's located, it's going to be a diagnosis of shingles.
This is one of those diseases that even nowadays, you know, we can diagnose just by knowing what it is. That history and physical becomes so important. Now, can somebody have that severe pain and not have that rash or breakout?
You can. It's called herpes zoster zinase. Not very common that I see it, but it can be where the blisters are inside the body. It makes the diagnosis more difficult. You got to go on the symptoms of burning, shooting, electrical type pain, especially worse at night. Again, anybody who's had chickenpox has a risk of getting this condition.
Now, there's a way to prevent this disease, and we don't have that many diseases we can prevent. So this is one of those that we actually can try to prevent.
Well, now I know, as you know, kids now are getting injections for or some vaccination for chickenpox. But more importantly, even adults in the age of 50 or 60 can get an injection called Zostavax.
Well, in my patients that I give them medications that depress their immune system, I get them this vaccination before they go on any of those medications.
Well, I'm telling you, this is one of the most devastating conditions that I see. It's very painful. Patients think about suicide. It's so bad.
So how do we treat this? How are we going to treat it?
Well, we can treat it many different ways. Antiviral medications. We can use sometimes some anti-inflammatory medications, sometimes pain medication. And what I like to do in a lot of patients is inject some steroids. Right near the level, wherever that level is where the nerves are coming out, I like to put some steroids right there to decrease the inflammation. And it works pretty well.
Well, those patients tend to get relief pretty fast, too. Not over a period of months, but over a period of hours. Even hours or days, they're going to feel much better.
Exactly.
So we can definitely increase the healing of this, put it back into that gel, close the door, because we didn't cure it.
Right.
The shingles
Exactly.
is there, but the blisters can heal. And are they going to leave a lot of scars? Is it going to look ugly afterwards?
Well, I tell people, don't play with the blisters because the blisters can either leave a darkened area or a whiter area.
Especially for our ladies, you know, don't want scars, don't pick on them, don't play with them, don't put stuff on them, just take your medication.
That's exactly right. We talked about shingles, which if it doesn't resolve on its own, it becomes, after the blisters are healed, it becomes postherpetic neuralgia, or pain after the herpes zoster is healed.
This pain topic is brought to you by the Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or online at carrascopaininstitute.com.